What was the main outcome of the COACT trial? The main outcome was the finding that in patients with an out-of-hospital cardiac arrest without signs of ST elevation, an early invasive strategy does not give you any benefit over a delayed invasive strategy with respect to the primary outcome, and the primary outcome was survival at 90 days. The rationale behind the COACT trial was the fact that there were several non-randomized retrospective data that suggested a benefit for an early invasive strategy in patients with out-of-hospital cardiac arrest, irrespective of the EKG. And because this was suggested but was never addressed in a randomized prospective trial, that's why we decided to design the COACT trial. So what are the main messages from the COACT trial? First of all, I think an important take-home message is that we really should always try to do randomized clinical trials if we're looking for the truth. Once again, we have a situation where we have a wealth of data pointing in one direction, and then we try to validate this in a randomized trial, and then data are pointing in another direction. Very specifically, take-home message for patients with out-of-hospital cardiac arrest without signs of ST elevation, there is no need for an immediate invasive strategy. So as a physician, you have some time to think about the specific situation, the specific patient, and then to decide either for an immediate invasive strategy or wait, bring the patient to the ICU and eventually do the angiography at a later point in time. Of course, we're still facing many questions in this very difficult cohort of patients. So yes, there will be follow-up studies. There will be follow-up studies with a very similar outcome like the COACT trial. So there are several similar studies still ongoing, so that we have, instead of the COACT trial, several randomized trials to also make true, strong guideline recommendations. But what I think is also an important finding of the COACT trial, as well as other trials, is that the reason for the adverse outcome, most of the patients with out-of-hospital cardiac arrest, is a neurological outcome. So I think we should really focus on that aspect of the disease in this cohort of patients.